India has administered almost 18 crore COVID-19 vaccine doses so far, with 4 crore people, or just a little over 3% of the population, fully vaccinated, which means they've been vaccinated with 2 doses. In the 18 to 44-year age group, less than 40 lakh people have received their first jabs, with the vaccine shortage slowing down the vaccination drive. Amidst the shortage and with no major uptick in supplies expected till at least July, the government has decided to extend the interval between the 2 doses of Covishield from 6 to 8 weeks to 12 to 16 weeks. Now, the scientific study supporting the extension has been available since February. So why this decision now? Let's also now move to the vaccine supply picture. The central government has said that August onward, it expects a sharp uptick in production and availability of COVID-19 vaccines, with over 200 crore doses likely to be supplied between August and December. Of this, the largest share of 75 crore is expected to continue to come in from Serum Institute. 55 crore doses are expected to come in from Covaxin of Bharat Biotech. Most of the other vaccines that the government is pinning its hopes on are still in various stages of trials. Let's also take a look at the short-term supply picture. According to the latest data released by the central government, between the 16th of May to the 31st of May, it will supply 1.92 crore vaccine doses to states and union territories from the central quota. This will include 1.63 crore Covishield doses and 29 lakh Covaxin doses. Well, joining me now to take this discussion forward is Dr. N.K. Arora, the head of Operations Research Group at the National Task Force set up by the Indian Council of Medical Research. He's also the advisor to the National AEFI Committee. Dr. Arora, many thanks for joining us here on CNBC-TV18. Let me start by asking you about the government's decision to move the Covishield dosage interval now between 12 to 16 weeks, Dr. Arora. On the 21st of March, in the Indian Express, you're quoted as saying that there is no good scientific evidence to suggest a recommendation to increase the interval beyond 8 weeks, especially given the fact that India doesn't have a shortage of vaccine. This recommendation to increase the interval between 8 weeks is more for countries and societies where there is a deficiency of the vaccine. India is in a very unique position because we are vaccine sufficient. What's changed, Dr. Arora? Dr. Arora, you're on mute, sir.
Thank you very much for inviting me, and thank you for quoting that March news item. The National COVID-19 Working Group has been reviewing this interval right from January. And in January, based on the studies done within the country, although we were privy to all the studies which were done by Oxford University, we were privy to all the data. But still, the committee was not convinced, and therefore we went ahead with 4-week interval. In February, when SAGE said that it may be useful to extend the data, the interval between the vaccine, we revisited the data and felt that beyond 8 weeks, the risk of breakthrough infection may be unacceptable. And we kept it open. Last week of April, the data has come from UK, 3 studies, which has showed that when the vaccine is given with 3 to 4 month interval, the vaccine efficacy remains between 65% and 88%. There are 3 studies. And it is this reason that the committee decided to expand the interval. Now, the question is why didn't we do it early enough when the others were doing it? Because our initial vaccine availability for more than 45 years, the vaccine total requirement is 660 crores till August, and that is even true today. But the vaccine interval now 18 to 45 has been added, so there is a vaccine deficiency, but it has nothing to do with vaccine deficiency. We would like our population to be getting the best efficacy of whatever vaccine is given. And this is the reason that because of the intense transmission of virus, if there are breakthrough infections, if the interval is increased, the country is going to establish a vaccine tracking platform, which will look at the data on a weekly basis and to see if there is an increased breakthrough infection 3 months later, we are going to revisit this. So the whole purpose is that based on good, robust scientific evidence, When we have the evidence, we use that and provide the best possible protection to our population.
Yeah, but Dr. Arora, if I may, sir, because, you know, there were studies that were presented in the first week of February itself. The WHO, as part of its guidelines, the WHO expert panel itself recommended the AstraZeneca dosage should be between 8 to 12 weeks. So all of this was available from the first week of February. This was the global practice and the global standard. Yet we decided not to go for that dosage interval. So, you know, people would also question then, have we compromised people who then actually took the shorter duration dosage? Have we compromised their immunity?
So, first of all, I think when we say global standards, the biggest user of global AstraZeneca vaccine and Covishield are two countries, UK and India. India is the largest user. Nobody else in Europe is using, they may have recommendations, but nobody is using it in agri. A very small amount of vaccine is being used in Canada. Rest of small amounts of vaccine, AstraZeneca vaccine, is being used in a smaller countries, some in our neighborhood also. But the true largest consumers of these vaccines are UK and India. The Indian committee was, we had reviewed the data, and we thought that the possibility of breakthrough infection between 8 and 12 weeks, we were really not certain. And therefore, the committee decided to wait till we get from the ground data, real life data from the UK studies. And that's what was available in last week of April. And within the first week, we've sat 4 times. And now we have decided to increase the interval from 12 to 16 weeks. But along with that, we are going to monitor if there is any change in the breakthrough infections between first and second dose.
Okay. All right. Let me pick up on the other point that you mentioned. You said that this is not linked to the fact that there is a vaccine deficiency, but you're also acknowledging the fact that there is a vaccine deficiency only because the 18 to 44 age group has now been opened up, which was not the consideration earlier. You said that 60 crore doses would have been required by August if you had gone with the 45 plus age group. But now that the government decided on the 1st of May to open up 18 plus, obviously, the supply is not keeping pace with the demand. So why then the decision for the government to open up on the 1st of May, knowing very well what the supply situation was?
So I think I'm not the right person to answer that question. But as far as our committee is concerned, and me personally, many of us were not in favor that 18 to 45 should be started till more than 45-year population is completely saturated and get both the vaccines. Because even today, we have reviewed the data as of 72 hours ago. The proportion of people who are dying are almost 75% or so of more than 45 years. One. The two, the disease severity requiring hospitalization is also in the same group. So the initial purpose of this vaccination drive was to reduce the burden of health system. And that is what is the purpose. And fortunately, what has happened, many of us are not realizing, at least one dose has been given to those who are above 45 years in 35% of the population in that age group.
Dr. Arora, I think you're on mute again, sir.
Am I? No, I'm not mute. At least,
now you're fine. Now you're fine. No, I just want to go back to that issue. You said that. No, I'll get you to just let me ask you the question and then you can continue. You said that you and several other committee members were not in favor of opening up the vaccine process for 18 plus till the 45 plus were saturated and given both their doses. Now, the fact of the matter is that 1st of May, the government has decided to open up. We've barely seen, across the country, 40 lakh doses being given in the 18 to 45 category. We've now seen 11 state governments resort to having float global tenders for vaccines because of the lack of availability in India. So where is this going to lead things, at least till July? Are we in a difficult position when it comes to supply and demand?
So the fact of the matter is globally vaccine shortage is there. Vaccine is not available. So even many of us are saying purchase from wherever it is available. The fact of the matter is that the vaccine is not available in the global market. If small amounts are available for a country of India's size, it will be peanuts. And as far as India's own production capacity is concerned, starting July, we should be producing several 3 to 4 times the vaccine doses currently we are producing. So currently we are around 7 crores. By July or August, we may be producing 20 to 25 crore doses every month. And as we move forward from August, September, October, ultimately somewhere in the fourth quarter of this year, we should be producing 30 crore doses a month. And that will be sizable amount. But till then, this vaccine issue for 18 to 45 to begin with will remain. I think that there will be difficulties in giving vaccine to this age group. But here I must also say that, as you have heard, there is a pediatric trial started yesterday for children between 2 years and 18 years. And that result should be available in September or so. And I can assure you that towards the later part of this year, if the results are available, we should start immunizing our young kids also.
Okay, yes, we are awaiting clarity on that trial which Bharat Biotech is taking forward, and we do understand that as and when we are impacted by a third wave, the age group, the children category is likely to be a vulnerable category. But I'll address that in just a second, Dr. Arora. And I want to go back to the comment that you made on the global vaccine supply. And you're absolutely right in pointing out that that is constrained. And most countries have already tied up with global vaccine makers like Moderna, Pfizer, etc. So this business of states having to float global tenders, is this symbolic? Because is it really going to result in anything in the short term?
So I cannot answer this question, but I must like to share with you that I chair the global COVAX facility also, which has been set up by WHO for providing vaccines to low and middle income countries. And there is practically no vaccine available for that facility because of the shortage. So I cannot comment much on the question of tenders and the response to that. But broadly speaking, there is very little vaccine available beyond what we have in our own country.
Yes, and that is the fact that we are going to have to deal with. But Dr. Arora, on the 19th of April, when the government decided to announce its liberalized vaccine policy, free up pricing in the hope that foreign manufacturers would start to manufacture in India or start to import in India, many guidelines have been changed to make that easier. We still haven't seen anybody do that, with the exception of Sputnik, which has already gone through the clinical trial process here in India. So where do things currently stand in conversations, in dialogue with foreign vaccine makers? I mean, are we anywhere close to seeing anybody besides Sputnik launch in India anytime soon?
So the other vaccine is Johnson & Johnson. So what has been done, as you rightly said, it is liberalized. The vaccine which has been approved by an international credible regulator, the vaccine will be allowed in the country, but concurrently they will have to do the bridging trial. So Johnson & Johnson is a good example. We also understand that they have tied up with a local company to manufacture it. And there are 1 or 2 other vaccine manufacturers. They have also tied up and to move quickly. I would like your audience also to understand, vaccine manufacturing is rocket science as far as pharmaceutical is concerned. It's not easy. It takes, even if when you know everything, all the know-how and everything, it takes 3 to 4 months, 5 months, or up to 6 months to initiate the manufacturing. and then processes have to be stabilized, and besides process consistency across batches, because we are giving vaccines to healthy individuals, and therefore a lot of steps are required before the vaccine can be given into somebody's arm. And therefore it is time consuming. But as I understand, after the liberalization, there is very rapid changes occurring. And even Bharat Biotech has now tied up with people, as you very rightly said, Sputnik is tied up with 6 manufacturers. So I think very soon, but we will have to wait for at least 2 to 3 months before the vaccine supply eases out.
Since you brought up the issue of Covaxin and Bharat Biotech, Dr. Arora, let me just, labor on that a little bit more, because, the Niti Aayog chief and the COVID task force head, Dr. V.K. Paul, said that technology can be transferred to anyone who's willing to produce the vaccine. Now, we do know that the ICMR is already tied up with 4 different entities, Hafkin included, to be able to start the production of Covaxin. But as you yourself pointed out, it is the rocket science of pharmaceuticals. It's not going to happen overnight. So when realistically do you expect these 4 other entities that the government is tying up with for Covaxin to be able to start delivering?
So as we understand, the government has provided support to these 2 or 3 or 4 entities. And by somewhere in September, I think they should start contributing. And this is the time. So because today the overall production capacity of Covaxin is about 1.5 crore doses per month. And we are given to understand they have set up a huge facility in Bangalore. And by August or so, July end or August, we would be getting 10 to 12 crore doses per month of Covaxin from various sources.
No, I just want to understand that. You're saying the current Bharat Biotech capacity is 1.5 crore doses. Bharat Biotech itself, through its own lines, is expected to ramp up capacity and could do 12 crore doses a month. But you only expect the others like Hafkin, etc., to start contributing to Covaxin capacity September onwards, right?
In around that time, and at the moment, their capacity would be around 2 crore doses per month or so. So everything put together, around 10 to 12 crore doses around that time. So it is not just Bharat Biotech. The others.
Okay, 10 to 12 crore doses of Covaxin by September or so.
Yes.
Is there a dialogue on with the ICMR, Bharat Biotech and Panacea Biotech? Because in terms of the BSL-3 manufacturing facility, Panacea Biotech does have that. Are there talks on with Panacea to be able to produce Covaxin?
I'm not aware of that. I am not privy to any information about that.
You are not aware of that. Any talks with Pfizer and Moderna? Because once again, yesterday also at the Health Ministry briefing, we did hear that, talks have been on and off and they continue. But what is the realistic picture in terms of imports of either Pfizer or Moderna into India anytime soon?
So what today is, we are also as much aware as you are saying that there is some discussion going on with mRNA vaccine producers like Pfizer and Moderna. How long will it take and where it will go? What kind of arrangements will it have? I think we'll have to wait as things consolidate and things become more clear in coming days and maybe in a couple of weeks.
Dr. Arora, you said that you were not in favor, and several other committee members were also not in favor of the 18 to 45 age group being opened up on the 1st of May, given the supply situation. But what about this business of states procuring, the private sector procuring, the central government procuring? Has this not made the whole process more complex, more complicated?
See, these are administrative issues and not technical. Technically, I have told that many of us felt that because in the light of vaccine shortage, we must first saturate 45 years plus. But the way rest of the decisions are made at different levels where none of us are involved. So I would not like to comment on some of the queries or clarifications you are asking for.
Fair point. I understand that. Let me once again go back to the vaccine shortage issue. At this point in time, till we see additional capacity come on board, on stream, which is expected post-July, do you believe the 18 to 45 will continue to languish at the levels that we have seen, currently? Most states are now talking about putting this on hold, starting perhaps closer to June, etc. Do you believe that this is going to have to be put on pause? And there are concerns about the availability of the second dose, even with Covishield having been extended now to 12 weeks and beyond. There are concerns about the second dose. Can you tell us whether that will be a cause for concern?
So, as we understand, there is clear instruction that those who have received the first dose should receive the second dose at appropriate time. So those who have already received, I don't see any difficulty at all, whether they are 18 to 45 or more than 45. But we must understand there is vaccine shortage for next at least 2.5 months, and before full steam vaccination for young people can take off. And as we understand, already 30 to 35 crore young people have already registered for themselves on the COVID platform, which is very heartening, which just shows that the keenness to get vaccinated. Although between 18 and 45, we have 50 crore people, but there is a lot of keenness, and we hope that that continues. But I think all of us must understand that rather than creating a false hope, in a realistic manner, we should say that most of these people will get vaccine over after next 8 weeks or so.
Well, I think that is a candid admission coming in there from Dr. Arora, saying that the realistic picture on the ground is that for those in the 18 to 45 age group, you might have registered, but you're probably only going to be able to get vaccinated 8 weeks down the line. That's the realistic picture if you look at what's happening on the supply side, and supply is expected to ease up only July onwards. That's the expectation at this point in time. Dr. Arora, always a pleasure. Many thanks for joining us here on CNBC-TV18 to take us through what the current situation is on many of those crucial issues that guide our vaccination program. We'll take a break. There's a lot more coming up. Don't go anywhere. We're back in a moment.
ये है